I call upon our next author, the next speaker, Dr. Surabhi. She is going to speak on 20% autologous PRP versus conventional treatment for dry eye disease, tear film, and impression cytology study.
Good morning, everyone. I am Dr. Shubhi SACHAN, and my topic is 20% autologous PRP versus conventional treatment for dry eye disease, tear film, and impression cytology study. Dry eye is a multifactorial disease of the ocular surface characterized by a loss of homeostasis of the tear film and accompanied by ocular symptoms in which tear film instability and hyperosmolarity, ocular surface inflammation, and damage and neurosensory abnormalities have etiological roles. Patients with moderate to severe dry eye disease, approximately greater than 30% of all dry eye disease patients, are initially advised lifestyle modification and treated with artificial tears. Biological tear substitutes derived from blood products have demonstrated good efficacy in reducing dry eye symptoms. Autologous platelet-rich plasma is a homologous homoderivative in which platelet concentration is on higher side. It helps in the proliferation, migration, and differentiation of corneal epithelial cells. The platelet-rich plasma get adhered to the damaged tissue, which releases cytokines and growth factors to improve healing. The aim of this study is to compare efficacy of platelet-rich plasma with conventional treatment in patients with moderate to severe dry eye disease at a tertiary care hospital. Objective is to find a treatment modality which is better in alleviating symptoms and signs, to find treatment modality with less side effects, to compare impression cytology in both the groups. It is a prospective interventional comparative study. Patients between 18 to 70 years of age with OSDI scores greater than 23 were taken, willing to comply with the 12-week study protocol and provide informed consent, being able to stop current dry eye treatment for 48 hours before starting trial intervention, and patient willing to for follow-up visit. Exclusion criteria was patients less than 18 years and greater than 70 years of age, uncontrolled systemic diseases, active infection or advanced cancer, pregnant or nursing women, have not recently used the following medications like anticoagulants or antiplatelets, have not used topical undiluted blood products within 3 months, have not gone through surgical interventions, ocular surgery within 6 months, do not have active ocular infection inflammation, have no contraindication for blood donation. This is a method by which we prepared platelet-rich plasma. We took the blue vacutainer, 3.2% sodium citrate as anticoagulant, and then the sample collection was done. We did the sample collection weekly. 10 ml of blood was taken, and then centrifugation of the blood was done in our department only. And first we did the soft spin of around 1700 rotation per minute, and then the second spin, harder spin at 2700 rotation per minute. Then the plasma was obtained and it was mixed with 4 parts of BSS and to make it 20% autologous platelet-rich plasma, and it is stored in amber colored bottles, and patient was advised to keep in a refrigerator. Observation and results. In this chart, we can see that the outcome measures were measured on the base of on the factors OSDI scores, BCVA, tear meniscus height, tear breakup time, Schirmer's stain, corneal fluorescence staining, and impression cytology, where we can see there was this, all the values were statistically significant, except BCVA. These are the pre and post treatment corneal fluorescence staining. In first pictures we see in the autologous PRP group, and in the second pictures we can see in the control group. These are the pictures. On the first picture, we can see the PAP is staining. We can see there was loss of cohesion and anucleated cells with severe keratinization, and after giving platelet-rich plasma, there was a reduction in the loss of cohesion was reduced, and nucleus to cytoplasmic ratio was also controlled and was reached to grade 1 in PRP, and in control group where there was not very significant changes. Discussion. Blood derivatives such as autologous serum and ARPRP are better modalities for the treatment of dry eye. It has added advantages over artificial tears as being preservative free and present a greater similarity to the natural healthy tear film. A total of 40 patients with moderate to severe dry eye disease were enrolled in the study. 20 patients were assigned to the case and control groups at random. The average age of case group was 51 plus minus 14 years, whereas control was 50 plus minus 17 years. At the end of 3 months, OSDI score was lesser in APRP group as compared to control group. Post-treatment, corneal fluorescein staining, TBUT and Schirmer score was also lesser. Conclusion. Autologous platelet-rich plasma treatment given for 12 weeks provides greater improvement in signs and symptoms and being preservative-free, it is devoid of any serious adverse effects, and impression cytology reveals better ocular surface in dry eye patients. Thank you.